Okay, when setting up an ABA therapy room, what items should be in there? And are there any spaces you recommend I look at that I can help with?
Yeah, I love this question. I think that there's so many potential answers, and it's so exciting. And I think it, like any of our answers, it depends. A lot of it depends on the population that you're serving, right? So if you're running a lot of groups, I think it's helpful to have like a big group area where you have a group table. We have like a kind of a U-shaped table so that the kids can sit around that table. I love the idea of having like whiteboards everywhere. We'll use a lot of whiteboards that are magnetic so that you can also like write on them, but you can have the schedule, you can post things there. So that's really helpful. Obviously, toys is a must have, but depending on the population that you serve, also thinking about, thinking about the kids that are coming into your room. You don't want, a 13-year-old coming into a room that's set up for a child. So thinking about where you're putting the toys or how you're partitioning the room, but having toys that are appropriate for all ages. So for the younger kids, having, a nice playful floor area where they can play on the floor. There might be some carpeting, and some really fun and engaging toys for young kids. And then also some good toys for some of the older kids. So the games and puzzles and books and things that they would really like. I like the idea also of like using furniture somewhat as dividers. So whether that means like, a bookshelf that's of a certain height, that you can also use it to divide up the space a little bit so that there are more separated workspaces is really good. Chairs at different height is very important because you don't want the 15-year-old sitting in the little toddler chair. So making sure that you have chairs of all different heights. Um, a good storage system is important. How are you storing all that stuff so that it's organized and that it's accessible? A file cabinet that locks is a must have. I could go on and on. Shane, I have anything to add?
My famous keep it simple. You want, when you're setting something up, you'll probably have so many ideas. And if you're anything like me, it's like, I want to do this, and this. I think the biggest thing is just get started. So, keeping it as simple as possible. I can probably go into a million stories. I have a clinic now, but I used to work in home based therapy. And I remember going in to meet this one child. Um, great child, but I walked into the basement where her therapy room was going to be set up, and she had a million toys in there. And I'm not lying, like her basement looked like Toys R Us. It had like a zillion things and they were all over the floor. And I had to pair myself with reinforcement with this child. And it was really hard to do because I'm competing with all of these toys. And, I couldn't get in front of her. And all she wanted to do was get away from me and get onto her toy. And if I couldn't, she couldn't get onto the one I was withholding, she'd just go to the next one. And it was just too much in there. So, the suggestion was like, can we put these toys in a separate area, or can we cover these toys so they're out of sight? And literally, like, I had a couple toys, like two or three toys that I would rotate between with this girl instead of having a million toys. So, exactly what Shira said in terms of like a few tables, the storage area is huge. And then putting some toys out of sight, rotating them every few weeks, is a really great thing to do too. Maybe clear containers so that students can see toys, but they have to point to them, manned for them, that kind of thing.